Okay, ovarian disorders. Okay, so we got something called polycystic ovarian syndrome. Okay, so PCO or PCOS, but it's also called the Stein-Leventhal syndrome. All of that is fair game for I could ask that, or for it to be even on your NCLEX or any future exams. Okay, or courses. The thing is with this, PCO is it's idiopathic. We don't have a cause for it, but we think it's possibly genetic. Okay? Basically what happens is that there's an increase of testosterone from the ovaries that creates multiple cysts in the ovary, but they never mature. So basically, if you have a lot of plants over here, let's say carrots and carrot seeds, and all of them grow at different rates, but none of them will make the full-blown, like when you pull out the stalk of the carrot, it's still very small. It's not edible at that time. Does that make sense? So for some reason, none of the carrots or none of the eggs ever mature, but we are growing them, and that's what happens over here. So if none of them mature, then are they going to ovulate? No. Okay? They have to mature to ovulate. So many follicles grow, but they never release an egg. Okay? It begins in teenager life, and then it goes on further until adulthood. So the symptoms here is obesity. Okay? It could be just overweight. It might not just be frank obesity. It might just be overweight. They usually don't have a period. Doesn't make sense. Like, you know, you're not going to have the cysts grow, so you're not going to have periods on there. And because the cysts don't mature, you're not going to ovulate. So you have anovulation, and that will lead to infertility. Okay? We also note that in women, they have a male hair growth pattern on the face and on the body. Okay? Now that could be a genetic thing. But when you put this all together, you got obesity, amenorrhea, not ovulating, and she has this hirsutism. Hirsutism is all of a sudden you get a lot of hair on the face, maybe the so-called mustache, or on the hands, very thickened hair on the arms. Okay, not the hands, but on the arms, on the legs. Okay. Now again, that could be a genetic thing. That could be because of where your ancestry is. I understand all that, but when you put it with other things and they can't get, you know, they've been trying, the couple's been trying to get pregnant for the past year, you've got to definitely put this in as a possibility as part of your differential diagnosis. Okay? So that's what that is. Some will develop diabetes. So knowing this, if this started very young in age, someone, let's say, who's 17 years old, who has PCO, they have a risk of also becoming diabetic later on in life. Okay? The treatment is a bit complex. I really don't want to talk much about it. But basically, it's you need to control diabetes if that has ensued already. That you've got to put them on birth control pills to try and get their hormones back in a routine. Sometimes you may have to remove a section of the ovary. So I really don't want to get into it. Just understand that you know, PCO is a pretty complex a treatment for it, depending on how severe it is, or the risk factors that, or the features that that woman would have. Okay. Okay, ovarian cysts. Now, there's a whole slew of different things over here. I'm going to try and keep it short but sweet here. It's organized by consistency. It can either be cystic, which means the cyst itself, which is kind of like a small balloon, is filled with fluid. We call it cystic. It could be filled with tissue, and that could be we call it a solid cyst, and that could be benign or malignant. So we're a little bit concerned about that. But the ones that we're really concerned about is a complex one, where it's going to have a mixed features of both cystic and solid. Okay, and we could just do a simple ultrasound to look at the ovaries to see if it's a cystic, solid, or this complex. When you see a complex mass there, it's usually a red flag that it means malignancy. It doesn't mean 100%, but we need to look at it. This could be very aggressive. But most ovarian masses that they find are usually benign cysts. Nothing to really worry about. But there's always that one we got to be concerned about. We got to do a workup on that. So we can also organize it by the way it works, not just the way it looks, okay? So we can have follicular cysts. There are basically mature follicles that have not ruptured yet, okay? So they're enlarged and they haven't ruptured. When I say ruptured, ruptured to release the egg. So this one is mature cyst, but the egg still stays in there. So we call that a follicular cyst, okay? We can have a luteal cyst, named after the corpus luteum, right? So this is when there is a ruptured mature follicle, okay? Graphene follicles is a mature follicle, and then it reseals in the luteal phase. Again, you need to know the menstrual cycle to understand this, the normal menstrual cycle. So we could have a lot of cystic follicles here. It may cause some pelvic pain, but it usually resolves in 1 to 2 cycles. So basically 1 or 2 months, it usually resolves on its own. So we notice that we do an ultrasound. We notice that there is a cyst there, and it looks cystic. We'll ask them to come back in probably about 3 months' time and see if it's there. If it's still there or it's gotten larger, we got to follow it up. But most of these will actually resolve by itself and be gone in 3 months. Okay? We could also have a hemorrhagic cyst, and this is a cyst that's filled with blood. Okay? They may rupture, and like I told you before with endometriosis, these may rupture and the blood starts irritating the pelvic cavity. And when it irritates, it causes a lot of pelvic pain for that. Okay? So that's what that hemorrhagic cyst is. And then we talked about these when we did the cancer chapter. Dermoid cyst, also known as teratomas. Okay? This is the cyst that's filled with those, it looks really nasty, right? It has teeth in it, it's got cartilage, it's got hair. These are usually benign though, okay? It looks nasty, but we need to remove it because sometimes what happens is these cysts could get so huge that the ovary can twist on itself and block any blood flow that goes to the ovary. We call that ovarian torsion. It twists on itself, and the blood vessel that would go there, which is only one blood vessel, that goes to the ovary, is now going to be kinked, and now there's no blood supply going to that ovary will die. We don't want that to happen because we want to have the hormones coming out of there. We want to make sure that they're also going to be fertile and that they can get pregnant later on. So we don't want it to become necrotic. So if these get pretty big like that, we still like to remove them even if it's benign to avoid any kind of ovarian torsion, twisting on itself, cutting the blood supply to the ovary. So this is just some pictures of cysts. This is our follicular cyst, pretty big over here. Okay. Other cysts, they have these ones over here have what we call septates. So we have solid, so this is one cyst over here, and we have areas where there can be filled with fluid, but we also have solid portions in here, these septates. Okay? So we have compartments, so to say. So this is what we call a complex cyst. It has fluid and solid material. These are notorious of becoming cancerous. Okay? And you can see other ones on there. You can see the septates on there. Right? Another cyst, and here's one that's got a lot of cavities inside there. Okay? This is a huge one. That little piece of paper up there is only 1.5 inches long. All right? So we're looking at this massive tumor. The largest tumor that I've ever removed was, I think it was about 25 pounds. Yeah, bigger than a baby. You know how heavy a baby is when it comes out at 8, 9 pounds, and you hear a 10-pound baby that's big. This is huge. Our biggest worry about something like this is that removing it, because if this is cancerous inside here, and it's all filled with fluid, if we remove it and the thing bursts, now you have all this cancerous fluid that's going all over the abdomen, and now you are spreading it. You are spreading this cancer as a iatrogenic cause of it. Does that make sense? Something that we did in the process of trying to remove it. So we've got to be very careful about doing something here. A lot of times doctors will see this big tumor. As the abdomen is open, they see this, and they'll take a syringe with a needle, put it in there without bursting it, and draw out a lot of the fluid so that we can remove this without all the pressure inside. Okay? There's one that was about 35 pounds. This isn't for me. I saw this on the internet just to show you how big these things can get. Okay? And she thought that she was probably just getting obese from all the food that she's eating. So you gotta, that's why it's important to always see your doctors and stuff once a year, or whatever preventative care that is going on. Okay? This is a picture from before showing a teratoma or dermoid cyst. There's those wonderful teeth that are in there, a lot of hair. And this is another picture. There's a couple teeth there and some hair on there also. All right. So it looks very nasty. But these dermoid cysts are usually benign, but these can twist on themselves depending on how heavy and big they are, and that'll cause infertility. Okay. Then we got ovarian cancer. All right. So ovarian cancer, most cases have no symptoms until it reaches a late stage, usually third stage cancer. Okay. Unfortunately, today, right now, which is what, 2019, there's no good preventative measures we have. Okay. 50% of these tumors, these cancers, are bilateral, so that's something to consider on that. Statistics, this is the 5th most common cause of cancer deaths in women. Okay, this is the 2nd most common cause of cancer deaths of the female genital tract. Okay, just to give you an idea. Endometrial cancer is number 1. Cervical cancer is number 3. So you can see that the endometrial in terms of the female genital tract. Right. So that's what happens with this. Okay. Symptoms. Pain as the tumor gets bigger and bigger, it can be pressing on organs, causing pain that way. One of the biggest things that a woman usually comes in to see the doctor for something like this is that they're getting fatter, they're getting more obese, their abdominal girth is getting larger, and by that time that means that there's ascites that's building up inside their abdomen. That means that the tumor, the ovarian cancer, has spread to the lining of the abdominal wall, and now the abdominal wall has become cancerous. When that does, that's stage 3. And when the abdominal wall, the peritoneal wall, is going to produce more fluid, ascites, now they start getting this abdominal girth that's getting enlarged. Does that make sense? And that's usually why they go see the doctor. Doctor, I don't know why. I'm not eating as much as before, but getting bigger over here, and I feel it's pretty tight. It's because of this. So by that time, it's like I said, it's already a late stage. Okay. So poor prognosis. 50% of people die after 5 years from the time of diagnosis with the treatment. That's a pretty high number. Okay. 60% ovarian cancer discovered at stage 3. Like I said, a late stage. Once it reaches the peritoneal cavity, meaning like the wall of the peritoneal cavity, it's already stage 3. Okay. Ascites, as I said to you before, is going to cause the fluid that's building up, that's ascites, is going to increase the abdominal girth, and that's a sign of stage 3 ovarian cancer. Okay. Questions on that? Okay, so let's just talk briefly about infertility. Okay, statistics on here. Infertility. Man and woman cannot get pregnant after efficiently trying to do things their way, within 1 year. Okay, 40% of the cause of infertility is related to female reasons. Likewise, 40% is due to the male reasons, which most people don't. It seems like the women get most of the reasoning why, and it's not. It's 40 and 40. The 20% is a mix. It's between, there's some issues of the woman and there's some issues of the man. All right, so that's where that comes in. Etiology I always use the mnemonic called T.O.E.S, okay? Make your life easier. Is there tubal reasons? Are the fallopian tubes blocked? Is there adhesions? Does she have a history of PID, pelvic inflammatory disease? Does she have a history of endometriosis? Does she have a history of any kind of surgery that may affect the pelvic cavity? Because that can cause adhesions. All right? So are the fallopian tubes blocked? Oh, ovulatory reasons. Is she ovulating? You know, if she's not ovulating, there's your reason right there. So PCO, Polycystic Ovarian Syndrome, that's one reason, right? It could be just DUV. There might be other reasons for that, okay? The E, exposure to the sperm. This is where it might sound like we're being a little bit nosy, but we need to ask them, how often are you two having intercourse? Are you doing it on the day that you're ovulating? Okay, that kind of thing. So is it on the 14th day or around there? Does that make sense? Okay? And then the last thing is sperm reasons. Is there something wrong with the sperm? You got to do a sperm analysis, right? So that's where he ejaculates into a cup. They're going to do an analysis of the sperm itself, how fast they're moving, if they're going in circles, is there a good number of sperm in one ejaculate? So they check all those different things, okay? So my mnemonic is T.O.E.S. These are really the only reasons, and there could be sub-reasons of all these, but these are the 4 main reasons why a couple is not getting pregnant, okay? So smoking, like I said before, that can also be an infertility thing that most people don't even think about. In females, we have in the fallopian tube, there's cilia. And the cilia is supposed to push this push the egg or the ovum towards the sperm, saying, Dad, he's a nice guy. Okay, good, keep on going, it's okay. Okay? So they kind of do that. In males, the sperm have a flagellum. And the flagellum makes the sperm go in one direction. Okay? Smoking will actually cause the flagellum, cause the cilia, because they both work the same way, just one is longer than the other, but they actually make them ineffective. They don't move as fast as before. So smoking can cause infertility in females and males alike because of the cilia inside the fallopian tubes and the flagellum of the sperm. Keep that in mind, okay? Other risk factors and etiologies that can cause infertility, I mentioned a few of these already. Pelvic inflammatory disease. Do they have a history of sexually transmitted diseases, namely gonorrhea and chlamydia? Do they have a history of any kind of endometriosis? Is there lyomas there, fibroids? Does she have a fibroid uterus that could be blocking the sperm and the egg from meeting? There could be an abnormal cervical mucus that's toxic to the sperm. The cervix is supposed to make the secretion easier for the sperm to swim in, right? If there's nothing there to swim in, like if you take a fish out of the water, it's just going to flop there on the boat deck. It's not going to do anything. It needs water to move it. So it's got to have something that's not too thick, right? Is there a resistance to eggs to fertilization in older females, right? So in other words, as women get older, the eggs become less and less resistant to fertility. They just don't work efficiently the way they should. Are there autoimmune diseases that are going on? Certain autoimmune diseases can cause this, lupus and stuff, okay? Is there any kind of hormonal imbalance, all right? If there's no LH surge, you're not going to ovulate, so you're not going to release an egg. We've got to find out reasons for that, okay? These are just some of the many reasons for infertility. They have a whole scope and a subdivision of OBGYN that's called reproductive endocrinology or infertility specialist that will just think of all these different things. Get you pregnant, and then once you're pregnant, after about 6 weeks, they then forward you over to a regular OBGYN. They did their job, they got you pregnant. Now, the OBGYN, the obstetrician doctor, is going to try and keep you pregnant. Does that make sense? Okay? So that's what happens.